Okay, as I said, give you just a global perspective on migration. Over 60% of all international migrants live in just a very small percentage of the world. Okay, and 20 countries, USA, Saudi Arabia, Germany, Russia, United Kingdom, comprise of about 67% of all international migration. Okay, so refugees. Okay, in the Caribbean now. So where migrants live in the Caribbean. So the majority of migrants live in the BOCT countries, such as the British Overseas Territories, like Turks and Caicos, Cayman Islands. The majority of migrants as a percentage of the population live there. Okay, and again, just look at migration. So the global population 7.5, globally 3.14% of the migration rate in the world, where in the Caribbean, our migration rate is about 17.5 coming from ECLAC. So we as a population, we migrate, especially educated persons. These are certificated persons migrate more. So we have a very, very high percentage rate. Okay, we have a lot of migration challenges in the region, and I think that's why PAHO and the WHO's commissioned this study. He said that the region is losing more of its population faster than any other place on the planet. Okay, and what is also happening is that over 40% of the countries within the region are already below the replacement fertility rate. Okay, so and the replacement fertility rate is 2.11. They said that if you want the country, your present population to exist for the next 25 years, the migration rate must be greater than 2.11, and we see that is already happening in the Caribbean. So as I said, on average, the fertility rate in the Caribbean in 1960 was 5.6, and in 2017 is 2.03. So in addition, we're leaving very, very, very fast, but also our migration rate, our fertility rate is very low. So there are some challenges, and I think I plot for Jamaica. In 1960 it was 5.4, 2016 2.09. So every country, its migration plus the low fertility rate is affecting every country in the Caribbean. Okay, so just want to now tell you something about the project. I said it was the general belief that migration of healthcare workers, there are challenges within the country. It was the belief that there are some of the push factors account to some of the migration rate, such as socio-economic, low wages, poor working conditions. So PAHO and the WHO and most of the ministers decided to commission a study to see what effect migration has on the healthcare sector. And our company won the project, so we were able to do this project. So this project was sponsored by PAHO and the WHO, and it was sanctioned by all of the ministries of health in the region. Okay, so I came to Jamaica, to Barbados, to Antigua, to all of the countries within the region. Okay, St. Vincent, St. Lucia. Okay, we divided the healthcare workers into 5 categories. Management and leadership, medical, doctors, nurses, auxiliary workers, and allied workers. So allied workers are like the dentists, pharmacists, etc. Okay, and these are the categories from Grenada right down to St. Lucia. Okay, what we also did, we divided the region into into 5 sectors. Jamaica as in region 1, Trinidad and Tobago and Barbados region 2, etc. And region 5, what we call the receiving countries that receive migrants. Okay, so they have a different perspective on migration than, let's say, their descendant country as Jamaica or Grenada, etc. In terms of the employment of healthcare workers, we found that the majority of persons within the study worked in the healthcare sector between 1 and under 5 years. Okay, so we see that we're seeing less younger and younger people within working within the healthcare sector. Okay, we also did a poll We interviewed 11,200 persons and asked them 2 questions. Why people migrate in the Caribbean? And we got the results. Okay, some of the observation, we found that the region will soon face some of the most critical shortage of healthcare workers in its history, if nothing is done about it. And I think that, and that I said, that's one of the reasons we did the study, because there is a serious migration challenge within the region, especially with healthcare workers. And we looked at the curve there with the fertility rate from where it's just decreasing year after year. Okay, we also wonder who is migrating. So far, most of the countries, migration is from Cuba to almost every country has a very, very high percentage of migration rate, with the exception of maybe 2 countries in the region, Suriname and Antigua. Okay, that's where people live. Okay, and where migrants live in the United States, Florida, New York, New Jersey. Okay, it said the research methodology, the study utilized a mixed method. Okay, respondents came from all departments within the government. Okay, hospitals, university, general hospital, laboratory, regional health authority. So we scanned everyone who worked within the government sector. Okay, we interviewed 533 healthcare workers, and as I said, we divided them up into medical nurses, allied leadership and management auxiliary workers. But however, it was oversampled through nursing, because obviously the effect of migration affected nurses, we believe, more than other sectors. Okay, some of the findings, we said that there is the wage disparity. A lot of places have issues with wages, the working conditions. People were burnt out, low job satisfaction, too much bureaucracy, lack of there's just lack of accountability. Lots of the healthcare workers experience lots of challenges. Okay, and we found out that the main concern of healthcare workers in the Caribbean, and we found out that throughout almost every country, is that the low perception of the profession, and so we found that healthcare workers felt that the public had a low perception of themselves. Okay. Even though they were considered under the ILO as critical care, essential workers, they are not perceived by the authorities. Okay, they said we asked people to please give 2 reasons why health workers migrate. We had from 11,000 respondents, okay, and they gave basically 35 reasons why people migrated. However, their top 7 is opportunities, better opportunities, financial, better working conditions, better facilities, lack of confidence in the healthcare system, lack of job security, too much bureaucracy, and lack of educational opportunities. So obviously the reason why people migrate. Okay, and I said that in terms of the recruitment, when we interview persons from the recruitment agencies, they said that 90% of HRH recruitment is done directly by foreign-based recruitment agencies. So the foreign companies will come in, they need health workers, they will come in and just take healthcare workers. There's no policy in any of the countries to have a policy on how many workers can leave, how many workers can, there is absolutely no policy. 94% of all recruitment agencies have no direct recruitment agent, no agreement with any of the government. I think with the exception of Jamaica, I think. None of the countries, any recruitment. Top 3 countries, Suriname, OECS, Trinidad, and Tobago. The preferred candidate for recruitment are persons who have degrees. So if you have a degree, it's most likely that you would be recruited by one of these agencies. Okay, healthcare workers in the diaspora, approximately 20% of the Caribbean diaspora said that they would seriously consider returning if the working conditions were better. Okay, healthcare. Okay, we asked persons again if how do you value if the healthcare is adequate? And on average, about 53% said that the healthcare in the country was not adequate, because these are the actual people who work within the healthcare sector. Okay, and this is just a description where challenges with Grenada, Trinidad, Dominica. Some of these countries have high level of disagreement with the healthcare sector. Satisfaction with working conditions. On average, 67% of the healthcare workers said that the working condition and environment in which they work are unsatisfactory. Okay, so which is with the highest is obviously Suriname. Okay, working conditions and environment in which health workers work. You see, most of them said they're not satisfied with the working conditions. Okay, and then we took an average of certain, with 10 questions we asked them, and that was the responses. I think for Jamaica we're in the middle. Some of them said, well, they agree, some said they do not agree. Okay, migration of and HR staffing. Many countries have difficulties at achieving a stable supply of workers, a stable supply of nurses for a consistent period of time, because the amount of persons that are leaving. Lots and lots of persons are leaving. Okay, migration consideration of health workers. On average, would you migrate if you had the means and opportunity to do so? We asked the respondents. Okay, 59% of them said yes. If they had the opportunity to migrate, they will migrate. These are healthcare workers on average. With regard to nurses, we said migration within, if you had the opportunity to migrate within the next 6 months or a year, 67% of nurses said yes, they would migrate. So the migration, the migration rate of nurses is higher than the general healthcare population. Okay, we also asked persons, I said, why would you stay? And we found out that the main reason why people stay in the Caribbean, for two reasons, healthcare workers. One, the first reason is for family obligations. That is for the parents. That's 15% of them. Second, family obligation because of their children. So the reason why I'm staying in this job is because of my parents. As soon as my parents die, I'm leaving here. The reason why I'm staying in this job is because of my children. As soon as my children grow up, I am leaving. Okay, so this is also very concern for the authorities. Some of the recommendations, I said, a salary review. Okay, we need to review the salary scales. They need a modernization of the public system. Challenges. We also see that there is a huge employment opportunity for the country because of migration. There's a lot of opportunities for economic development, training, certification. Maybe the countries can have a nursing school. Okay, because the demand for nursing would not diminish. It will get more and more and more so we have to do something for it. So maybe more nursing schools should be opened. Okay, we also said that the training and adoption of health administration best practices. Okay, you also need what is called a national qualification framework in all countries. So what we also see that a nurse in Suriname is different from a nurse in Jamaica, different from a nurse in Grenada, different from a nurse in Antigua. So they need to have standardization. A midwife in Suriname is different from a midwife in Jamaica, but they all call midwives. So all these is standardization. Okay, transparent process for employment promotions. There's no, if you want to become, if you're a nursing aide and you want to become an RN, there's no clear pathway. So people are confused within the system. So these things must be standardized. Okay, the establishment of a migration policy. There are no migration policies within the Caribbean. So if I have a company and I need 200 nurses or 5,000 nurses, I could just double all the nurses' salary or triple the nurses' salary in Jamaica, and in 6 months you have no nurses. There's no policy in any of the country. And this is something that is critical, and that's something that the foreign companies, the foreign recruiting agencies know. And I said, I said when I'm interviewing one of them, they said that it is better to recruit than to train. Okay, it is better to recruit than to train. You would take $200,000 to train, but to recruit them is like maybe $40,000. Mm-hmm. And what they're doing now is that when they are recruiting you, they not only recruit you alone, but they recruit your husband, your children, your parents. So I mean, how could you say no? True. And they double your salary and give you a place for 5 years? And from our data, the average nurse or the average person who leaves the Caribbean as a nurse, they stay on average about 5 to 7 years with that institution. So you have a good return on your investment. So it's profitable for the recruiting agencies to recruit nurses from the Caribbean region. Okay, so we see that. So, right, yes. And in summary, as I said, we have to establish regional health authorities. We have to look at private partnership. For example, what is done in the Turks and Caicos Islands. The Turks and Caicos marry, the government marry with the private sector to have a hospital. Okay, so we need they need to have what is called a more labor market intelligence. We see that the healthcare sector may not be in a line with major education. Okay, so we need more collaboration. Okay, and this is basically.
All right. Well, thank Mr. Justine Pierre for this informative presentation. We will take an approach this afternoon where question and answer is concerned. We have 3 minutes, and we want persons to state their names and their affiliated institution for the records. So the floor is now open.
Okay, Clement Lambert, Northern Arizona University. I thought your presentation was extremely interesting. I know migration is topical, and it has been over decades, as you highlighted. Now, have you actually looked at at the experiences of the migrants after they have entered the different countries, or do you want to look at what pulls them away from the country?
Okay, very good question. Yes, we had some focus group sessions with migrants from the region, a sample based on the same criteria: management, medical, nurses in Toronto, United States. Some of the local universities helped us, to meet migrants. And so yes, it was very, very interesting. But most of them, they have a very low opinion of the experience in the Caribbean. So they said, I had to leave because the government or whatever pushed me to leave or whatever. Okay. But if I have to return, it will take a lot of changes in the Caribbean. But I'm not seeing that change right now. Okay, so that's why only like 20% of them said it. If the working conditions are better, okay, they will leave, because when the recruitment agencies take them, as I mentioned before, it is a strong pull. Not only economic, it's a strong economic pull, because they get like, I met someone, she had a master's degree, and she was in the hospital, master's degree with 5 or 10 years experience. She was making like equivalent of $1,200 per month. In the country, yes. In Jamaica, I'll use Jamaica experience. Okay, and she left, okay, and she was making like $87,000. I think she was in the ICU now, $87,000.
I noticed you've been rubbing shoulders with the policymakers. I saw your
Yes, yeah, we spoke.
Now, what are they concerned about the migration, and what are they doing about?
Yes, yes. A lot of the governments are concerned. In fact, high praise to the minister of Jamaica. Like I mentioned, I find that in my opinion, was very, 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 very concerned, very interested in making changes. Okay, that's one of the whole issue with the study came from his idea. Okay, so yeah, I think that most of the Caribbean, for example, Antigua, because the nursing in Antigua is sort of different, because in Antigua there is a medical benefit scheme that generates money for the nurses. So healthcare workers, especially nurses, are sort of they get better resources than let's say Jamaica or Suriname or Grenada, for example.
The reason I'm asking, I looked at a teacher migration study and worked close with someone doing the teacher migration research, and some of them are the same things. For example, the recruiters.
Yes.
The recruiters make a bag of money.
Yes.
By recruiting these persons.
Right.
Yet our governments don't seem to be smart enough to tap into some of these.
Yes.
Sometimes $18,000 per
Yes.
for a teacher.
I had a very interesting study. We recruited 32 of the recruiting agencies. It's big business, huge margins. So the hospitals now are not recruiting anyone. So you cannot blame the hospital. They set up a recruitment agency who recruit on behalf of the hospital, and they get the amount of money they get. So it's an incentive, and they also have brokers now. So I might be a broker who work for it's big business. It's huge business. Okay.
Any more questions?
Any?
Richard Leslie from University of the West Indies.
Yes.
You gave some projections of the growth rate and migration rate,
Yes.
and everything is declining.
Yes.
Migration rate is increasing.
Yes.
What is the projected turnaround time? There can be a turnaround.
Right. Okay then. So for example, there's something called the replacement for fertility rate. I said that it's 2.11. In the Caribbean, on average, it's about 2.03. We are declining. Okay, certain countries have are low, like Cuba, Trinidad, very low rate. We see that as you move from the rural areas to the urban areas, you have less children. Okay, and more people are having quote unquote less children within the Caribbean. So my advice would be to import workers. You see, so we leave because migration, there are certain trends, okay? So we need to get people in, because we cannot tell persons to go and have more children. We have to get persons in. So persons in from, let's say, from South America. And then when they come in, then we will now leave. Because remember that, we have the perception that the Caribbean was always populated with African American people, but that's not true. We as a Caribbean region, African American people are very small percentage, about 33.3% of the Caribbean.
English speaking.
Yes. Okay. So we're very small, but we think that So most of the governments in the region, most of the policies, in fact, my experience, even though they know that it is declining, it's very hard for them to say, well, we will increase, we will invite. I'm just, say hypothetically, 10,000 Venezuelans to take up citizenship in our country. I'm just saying that. So, but something has to be done. Policy has to be done. I'm not a policy maker. Okay. Any other question? Okay.
All right.
Okay. Thank you.
Once again, that brings us to the end of this presentation. And thank you again, Mr. Pierre, for presenting to us this afternoon. We'll have our next presenter preparing.